Well, good afternoon, everybody. Welcome to our lunchtime seminar. My name is Mervyn Bothwell. I'm actually representing Marion O'Rourke. Unfortunately, Marion is unwell at the moment, so I'm filling in for her. But you're all very welcome to this lunchtime seminar, resourcing Northern Ireland's social care workforce to support people with grief and bereavement, and the launch of our Grief and Bereavement Resource. Do hope that you find this session useful and that it'll be valuable for a range of roles and services, but particularly for the social care workforce who are supporting and caring for people who are affected by grief and bereavement and work in settings where people may die. And it is timely that this session is happening during Grief and Bereavement Week, which is between the 2nd and the 8th of December. I want to just give you a bit of background to the resource and to why it was developed. Providing support to people who are dying or bereaved is part of the professional and caring role for a range of staff across health and social care. And for those working in or working with the community and voluntary sectors in Northern Ireland. This resource, which we're launching today, has been funded by the Department of Health and followed on from the work of its bereavement support workstream. And funding was made available to the Social Care Council for the development of a digital learning resource to support the social care workforce and others in providing bereavement support. If you could put up our next slide, please. This resource is just another example of collaborative working that we seek to do within the Social Care Council. And you can see the partners that are listed there on the screen. And we want to thank the partners. We want to thank the Department of Health. We want to thank our expert reference group, which was made up of a number of organisations, which you can see on the screen there. And I think we do have apologies today from Eleanor Ellerslie from Crew's Bereavement Care, and also Ethna Scallion from the Southeastern Trust, who can't make it today. But we want to thank those people who were involved in that expert reference group, which kept us all on track. We want to thank the people who were filmed for this resource, and you're going to see some of those films today. And I think maybe we might have one or two of the people who were filmed that they're perhaps here and perhaps joining us. I'd like to say particular thanks to Heather Russell, who you're going to hear from a lot today during the session, and Heather for her major contribution to the content of this resource. And I'd also like to pay tribute to two of my colleagues, to David Hamilton, but particularly also to Mairead Harkin, David and Mairead, who produced this resource, and for the considerable effort which Mairead has put into this. I'd like at this stage to just introduce Sean Holland, our Chief Social Work Officer, Social Services Officer for Northern Ireland, and we've got a little clip from Sean. So perhaps we could show that now.
Hello, my name is Sean Holland. I'm the Chief Social Worker for Northern Ireland. I am immensely proud of the contribution that social care staff make, wherever they work, in providing the support people need to live the lives they want to lead. The work is immensely satisfying, but it can be far from easy. Something that social care workers often say to me is that when they are supporting someone, they can be the only regular human contact in that person's life. It's one of the reasons social care matters so much in the lives of people. Good social care is all about relationships. This Grief and Bereavement Resource has been developed to help social care workers when they are supporting and caring for people affected by grief and bereavement. Grief is the normal process of reacting to a loss. Grief and bereavement is experienced in the normal course of our lives, but the global pandemic and the sudden loss of lives in such a short period of time has impacted on many of us. Part of the social care role at the end of life is to offer support to the person who is dying and their family, to help people die as comfortably as possible and to help preserve their dignity. This has been challenging during COVID-19. The Health Minister has provided funding to the Social Care Council, working with others to develop this digital learning resource, which has been endorsed from the Northern Ireland Bereavement Network. It will be a valuable learning resource and can be used by all Social Care Council registrants, health and allied professionals, families and carers, and anyone who is supporting or caring for people who are experiencing grief and bereavement. I'd highly recommend this resource to you. Thank you.
I'd just like to reinforce just what the message there that we've just seen, and that is that whilst this resource has been targeted for the social care workforce, we're finding that this resource can be applicable across a number of roles within health and social care, and indeed to anybody who's supporting somebody who is experiencing grief and bereavement. The way the seminar is going to run now is that I'm going to hand over to Mairead and also Heather. They're going to do their presentation. They will be talking. There will also be images coming up, and there will also be some videos as well. After Mairead and Heather present, then there'll be an opportunities for some questions. But please do use the chat function if you've got some questions that you'd like to ask as we go along. Then it'll be back to me just to wrap things up. So at this stage, I'd like to hand over to Mairead Harkin and also Heather Russell. Thank you.
Hi everybody, we're delighted to be here at this point, launching our Grief and Bereavement Resource. And the Grief and Bereavement Resource, like all our digital learning resources, is hosted on our Learning Zone website, and it's free to access with no logins required. So it can be accessed anywhere, anytime, any device. So I just want to give you some background before we go into the actual resource itself. So we have, as you can see on the slide, over 50 resources currently on the Learning Zone on a wide range of topics that aims to supplement and complement the training provided by social care employers. We have developed our learning resources based on evidence-informed learning experience design to support our registrants to discover meaningful content that supports their workflow and continuous learning, engage in positive learning experiences, apply and transfer what they've learned into their practice, and reflect on their learning and the difference it makes to the people they are supporting and caring for. We do not build in end of module assessments or certificates of completion like many traditional e-learning modules or courses, as our focus is on reinserting the importance of learning. Learning involves more than attending events and workshops or completion of e-learning modules. It can be experienced in many ways in a variety of contexts and requires support and guidance and a holistic approach. And key to that is that it is a continuous learning journey where people are provided time to learn, time to acquire learning, time to integrate and consolidate learning so they can apply what they've learned in practice. And we hope our learning resource like Grief and Bereavement today goes some way to supporting that learning journey. And to that end, we build in authentic real-world scenarios and reflective learning activities into all our resources, and the completed reflective questions can be used to evidence their learning and can be used to meet their post-registration training and learning requirements. We also create content that is chunked down to reduce cognitive overload. It is interspersed with relevant multimedia and images to provide a more effective, efficient, and enjoyable learning experience. But let's now look at what is in the Grief and Bereavement resource. So this slide is taken from the menu of the resource, which we're going to show you very shortly. And as you can see, we have 8 sections within the resource. So we have our introduction, we have a section on what is grief and bereavement, what is a section on what is communication, good communication, what to do when someone dies, a section specifically on grief and bereavement during COVID-19, and a section on self-care and why this is important. We've also added in an additional section on situations that may challenge you, and then we finish with our summary and background. So along with Heather Russell today, we are going to provide a demo of a number of the resource sections. So I'll not dwell too long on this slide, only to say there is a lot of content within this resource and links to additional information. As with all our digital resources, this is to provide both the need-to-know content for novice learners and those unfamiliar with the topic, and more in-depth content for those who are more familiar and who want to delve a little bit deeper. As we know, our learners are different. They all come with prior knowledge and experience and are at different stages of their learning journeys. So we hope we've pitched this right to ensure a wide range of learners can access and learn from the resource to support them better understand grief and bereavement. So this slide shows, is a part of some of the images from our introductory section of the resource. And when users launch the resource and open section 1, they'll find an introduction to the resource beginning with an explanation of what grief is, a normal process of reacting and adjusting to loss. This is followed by an acknowledgement of how important the social care worker role is in supporting and caring for people who are experiencing grief for whatever reason. This is followed by the first of the Heather Russell films, as you see Heather there in the centre. Heather, as you've heard, is a bereavement coordinator with the Belfast Trust, who has helped us develop this resource in partnership with members of the content reference group that Mervyn explained earlier. And she kindly agreed to be filmed to provide 8 introductory films that are located at the start of each section. She provides a soothing and reassuring tone within the resource, as this is a difficult topic for learners and the content can and may upset learners. We also refer to COVID in the introduction and its impact on grief and bereavement, and include an acknowledgement that we have developed this resource during the worst pandemic in memory. So that is why we've included a separate section, and we do hope at some point when things normalise that can be removed. This is then followed by learning outcomes, of which there are 7. So our learning outcomes, you can see there on the right hand of the screen. Number 1 is understand and recognise normal and appropriate grief responses. 2 is be aware of the needs of dying and bereaved people and the role you have in supporting them. 3 is have an awareness of bereavement information and support that is available. 4, understand the importance of delivering compassionate and respectful care at the end of life and into bereavement. 5, understanding the importance of and what contributes to good communication at the end of life and afterwards. 6, understand the personal impact of loss, grief and bereavement, and the importance of self-care and personal resilience. And 7, know how to avail of support if you have concerns about your well-being. So our learning outcomes in the first section are also followed by a component on our standards, and we include this component in all of our resources. And this is to remind our registrants that the resource can be used to provide evidence that you are meeting the standards of conduct and practice. But they also provide registrants this is added to provide registrants with consistent messages about the standards, values and best practice to support our registrants to embed standards into their day-to-day work and delivery of services. And finally, in this section, we also include how to use the resource. This is a standard component in all of our resources, and it's a reminder also to users that you do not need to complete the resource in one sitting. There's a lot of content within our resources and in this resource. It is not designed to be completed in one sitting. But we recommend you dip in and out as and when you need to, and go back to sections as often as you need to, and use the resource in this way to support your understanding of grief and bereavement. And we've developed in this way to help you remember the key messages of how you should behave and what you should do. So we also recommend and encourage staff to discuss content and bring it to team meetings and discussions with their managers, as that is all part of an ongoing learning process. So now I am going to stop talking. I'm going to hand over to Heather, and Heather's going to start to take you through the content within the resource while I open up the resource.
Thank you, Mairead. Hello, everyone. It's very appropriate that this resource is being launched during Grief and Bereavement Week, and that you're here today, probably as a health or social care worker or a volunteer who plays a vital role supporting people and their families at this particularly sensitive time. Whether you've been working in the sector for many years or are quite new to it, you have recently been required to respond to very difficult situations that no amount of experience or training could ever have prepared you for, due mainly to the widespread of COVID-19. And I want to acknowledge and thank you for the very important contribution you have made, especially during the last couple of years, probably at a personal cost to yourself. I am aware that while you may care and support people in many circumstances that will never be your personal experience, death is universal. It will happen to all of us, and you will probably have experienced bereavement, possibly in the recent past. If the content of this presentation touches a chord with you, please take a break and come back when you feel ready. While death is a universal experience, it's something that we don't always like to talk or think about. When we're trying to support a person who's bereaved, we can feel inadequate, not equipped to best help them, and afraid of saying the wrong thing. It is my hope that accessing this resource will give you knowledge and confidence when someone in your family or at work looks to you for help and support. At the outset, let me say that nothing anyone says or does can take away the pain of the loss of someone we love, but how people are present for us, how we are supported and communicated with, how we receive the information we need to make sense of what happened or know what to do next, has a massive impact on us and the journey that we will experience. If it is done well, we are helped along that difficult path and will forever be grateful to those who help us. I'm sure you can think back to the people you couldn't have done without when you experienced a bereavement. And daily I hear praise for the team or person who looked after a loved one in their final days, weeks, or hours. And at times I hear the anguish of bereaved people who have questions or a feeling that things could have been done better. As I already mentioned, this resource covers many elements of care and support before, around the time of, and after death. Some relate to specific circumstances, and some apply to every situation. I would like to look in more depth today at 3 that apply to everyone. They are: what is grief and bereavement, communication, and self-care. And the others can be referred to as and when you need them when situations arise, though it would be good to look through them all before you find yourself in a situation. So what is grief and bereavement? Everyone working in health and social care should know what grief looks like, not only because they will experience it themselves, but also because they will be supporting people who may display challenging grief reactions such as anger or blame. And while that can be intimidating, it's good to know that is what the person just needs to do right now because of the situation they find themselves in. So you will know not to take it personally. So this section in itself has many elements. You will find understanding grief, theories of grief, bereavement support and different levels of support, recognizing you to understand and recognize normal and appropriate grief responses, be aware of the needs of dying and bereaved people and the role you have in supporting them, and have an awareness of bereavement information and support that is available. So if we go on down to understanding grief, there are many factors that influence the grief of a bereaved person, and they can be their personality and their past experiences, the closeness of the relationship, the circumstances surrounding the death, their culture and beliefs, and available family and community support. And grief impacts us in every part of us, from our emotions, where we can feel shock, fear, helplessness, sadness, longing, guilt, shame, and anger, to our physical response, where we cry, we feel tired, we can't think clearly, we don't sleep well, and we can have bad dreams or flashbacks. We can have headaches and dizziness and a loss of appetite. And then spiritual responses, we can be searching for meaning and why did this happen? It can strengthen our faith if we have a faith, but it can also make us lose our faith or spiritual belief. There have been theories of grief for many years. In 1969, Kubler-Ross, I'm sure you've heard of, described stages of grief. And then William Worden talked about the tasks of grieving. But both of those theories and the early theories expected the bereaved person to eventually move beyond the person who has died And now we know that we will never move beyond the person who has died, and that we will continue to have bonds with them. And class talked about continuing bonds, a new understanding of grief, which is the third one, I think there, Maria. Yeah. And they would say that the bonds that we make with the people that we love in life are too strong to break, for death to break, and that we will continue to have a relationship with the person beyond their death, and that is what should be expected, rather than telling people they'll get over it. They'll learn to live with it. And if you look at the next slide, where grief doesn't follow a straight path, the dual process model, and instead of us moving up and up and up and out the other end, we know now that we are like a pendulum that swings backwards and forwards between grief and loss. And then on the other hand, attending to life and getting on with things and making a new start and having to get new routines. But then something happens, like what will happen very soon, Christmas, and people will again be immersed in their grief when they think about those who aren't with them anymore. We used to also think that grief got smaller as time went on, but our next theory about grief stays probably the same, and we grow into bigger people to manage our grief and carry that grief. And talking to people who have been bereaved, they'll say, I'm a different person now than I was before this happened, and I'm doing things now, or I can do things now that I wouldn't have been able to do before. And that's our jobs are probably to help people manage their grief and carry that grief. There are three different levels of bereavement support, and most of us get by with the support of our family and friends and enough information to make sense of what has happened. Others will benefit from going to maybe an organisation where people have a similar experience to themselves, and they can share their experiences, or they can talk to a counsellor. But some at the therapeutic level have maybe not been well before they were bereaved, and they will then need an intervention that helps them manage their grief. Complicated grief is whenever it takes a longer time for people to adapt to their life after their loss. And most of us the pain will reduce, we will be able to function better, but some people can't, and it goes on for a lot longer, and that will be complicated grief. And you notice that they haven't moved forward, and they are not able to do the things that they should at some stage. But again, they may have already had problems, or they have experienced a traumatic death, or they have had a significant dependence on the person who has died, or if a child dies, it's really difficult for families to ever come to terms with that. If you are working with someone who you're worried about, pass that worry on to somebody that you feel like your manager, who will be able to help in that situation. And at the end of this section, there is a presentation by Cruz on grief if you want more information. And as at the end of every one, there are additional links, reflective learning questions, and lots of things to work through that will give you more information. If anybody has any questions as we go through, I don't know whether you want to put them in the chat as we go along, but there will be a question and answer session at the end. I'm just going to take a drink. Communication is something that is very important for all of us to do well. There are many aspects to communication, including what we say and how we say it. And when someone you've been caring for or supporting dies or is bereaved, it's sometimes hard to know what the right thing to say is. Just know that nothing you say can fix them or take away their grief and pain. But the tone of your voice, your body language, is what people remember, even if they instantly forget what is said, and they will feel your compassion and care even before you speak. If you do it well, you're part of their bereavement story, and the person you're supporting and their family will tell others how much you helped them at such a difficult time. And I'm sure if you take a minute to think back to a time when you experienced the loss or death of someone special, you think about things that were said to you that were helpful, that you would say to others in a similar position. And I'm sure you can think about things that were said that you know you would never say to anyone else. Some tips around communication would be person-centered. When you're when you're with somebody who's been bereaved, they should always be your center of attention. And that's really important. If there are two of you working together, you know, don't talk to each other. Always have the person that you're looking after as the center. And that, I mean, that you would know that already through all of the other learning that you've done. There are different ways of communicating, and there might be times when you need visual aids because the person finds it more difficult to understand, or using descriptive language. Again, if a person has a sensory or a learning disability, it might be better to explain things using descriptive language. It's very important when you tell people things or they ask you questions, and when you give them their answer, say it in short sentences. If you're giving them information, use short sentences because it's really hard to retain information whenever you're upset. And also check, ask them to say back to you what you've said, because they might have completely got the wrong end of the stick. And if they have, then you have an opportunity to repeat it. Think before you speak. Sometimes you're presented with a difficult question, and we won't always have the answer to the question that people ask us. So don't just leap in and say something, but think before you speak. We in Northern Ireland especially are very bad at having a silence, and we like to fill our spaces with things to say. And sometimes we say things that are maybe not helpful. So it's important to think about what you're going to say. And there are some things we shouldn't say. You know, if an elderly person dies, it's not a good idea to say, didn't have a good innings. Maybe that's what their family will say to you. And that's where you know their head is, but that might not be where they are at all. They might just absolutely want them still to be here, or their pain is over. Again, a family member might say that to you, but it's not our place to say it to them because they might just want that person still to be here. So say something neutral, like, because we're not good at saying nothing, put your hand on their arm. I mean, I know we're living in the middle of COVID, and we would like to give people hugs at the minute, and we mightn't be able to do those things anymore. But put your hand on their arm and say, I can see this is really hard for you. I am so sorry. And that brings us into the situation with them, and lets them know that we care. Lets them know that we care. All right. If people want to talk, let them. And as I said at the start, sometimes they're cross, and sometimes they shout at us, but it's important to acknowledge that and to say, I can see that you're feeling very angry, or it's understandable that you're angry, or just let that conversation run, because it's good to get it off your chest, isn't it? You know, and listening is probably a more important part of communication than talking. So I think we have, there is a section on communicating with people with a learning disability and people with a dementia, but at this stage, I think we're going to play Andrea's video, aren't we, Maria?
Yep, just going to play it now.
My name is Andrea McComiskey. I'm Acting Care Home Manager. We provide a service for people with learning disabilities and physical disabilities. In total, I've worked in health and social care for approximately 15 years. About 4.5 years ago, I had a service user who had a diagnosis of low functioning autism. The service user came into our care because his main carer had been diagnosed with a life-limiting condition very suddenly. There were no other family members, and it wasn't long until his main carer passed away. The issue was that the service user wasn't informed of the passing of his mother and wasn't able to attend the funeral. The decision was made following requests for the service user, from the service user, to see his family, see his main carer, and that was getting more difficult as time has gone on. The service user was informed of the death by two senior healthcare assistants, and that was really when everything changed. Initially, we had started to see changes in the sleep pattern. There was a bit of aggressive attitude towards staff and service users alike. Unfortunately, the behaviours, they didn't get any better. It just went from one extreme to the next, and the service user unfortunately had to be detained under the Mental Health Act. Everyone was greatly affected by it. I mean, the service users and the residents, had to watch this on the eve of being sectioned. There was a lot of commotion, there was a lot of activity, and it was very unsettling for everybody. There were a lot of health professionals brought in. It was just not an ideal situation for anybody to witness. The staff didn't know what to do to support the resident or the other residents and service users in the building at the time, and it was very emotional for the staff. The staff had cared for this gentleman for quite some time. The main learning from what we witnessed at the time, it wasn't comfortable for anybody. Nobody really should have had to witness what unfolded that day. I think we focused more on the behaviours of the resident at the time and not enough on the reasons as to why the behaviours were displayed. I think we took a lot of lead from GPs, probably not enough lead from counselling services or bereavement resources, or we didn't research it at the time. We didn't do the background work, I feel. Yeah, there's many resources now, and I think more so there's lots of digital resources now. Doing a bit of bereavement counselling, looking up the resources, reading some of the books, going online, doing some of the training. In my view, it's to treat the person as a person, the same as you or I. They're no different. They want to know about the grieving process. I would expect staff to support the person by creating memory jars, by reminiscing, sitting and supporting them, helping them to talk about their loved ones, to reassure the resident. If I was in the same situation again, I would make sure the service user was informed right throughout. I would make sure the service user was maybe able to see that person in hospital, was kept up to date with all of the progress. I would make sure the service user was involved in the planning, and then following that, I would help the service user create a shrine or some sort of space for them to grieve and reflect. I would expect the service user to know how to grieve, to be supported in that grieving process, and to understand how to mourn.
And I think it's very obvious from that just what was above it, I don't need to go up, Maria, but I'll just read out. Each person with a learning disability will grieve in their own way. Some people may feel that withholding information about death from people with a learning disability can minimise anxiety. However, generally this is not helpful. Having a learning disability doesn't mean that a person cannot be affected by, cannot understand, or cannot deal with the bereavement. And most people with a learning disability will progress normally through the grieving process if they get the support they need. Delayed reactions to grief are common for people with learning disabilities, and while some people may appear to cope well at the time of their loss, they may experience difficulties in the weeks, months, or even years after the death. The person's disabilities and communication skills will have a significant impact on their ability to understand what has happened and on their ability to express their thoughts, feelings and opinions. And I think that video shows very clearly the frustration of a person with a learning disability who was not kept up to speed about what was going on in the life of a person who was the most important person to him. So we've included the section on learning disability, and then there is a section on supporting someone with a dementia when they are bereaved. So hopefully you will find useful information in there too. There's also a cruise presentation on good communication and additional information and links, as well as reflective learning scenario with questions. All right, so let me just think now. We're going to look at COVID. We'll just have a quick look at the COVID section. Not right, what are we doing next? The COVID pandemic has been with us for, well, nearly 2 years now, and the virus and the restrictions required to limit its spread have, or if they've been bereaved. Depending on where death occurred, family members may not have been present with when their loved one died, and may not have been able to see them after death or bring them home before the funeral. And health and social therefore have been required to take their place of a family member at the bedside of a dying person, and at times help with the family's final goodbyes using phones or tablets. And this has all been really distressing for everybody. Care home residents, because of their age or general health, have been extremely vulnerable and may have died at the height of the pandemic. Many died at the height of the pandemic. And the vaccine rollout has reduced the severity of illness and provided hope that our vulnerable population is once again safe. And in this section about COVID, there are the challenges for support workers due to COVID, new ways of working required by COVID restrictions, keeping people with a dementia safe during COVID, and how working in such environments may affect social care staff, health and social care staff. And I mean, I take my hat off to everybody who has endured, probably that's the word to use, the last couple of years, because they have been particularly difficult. Of Stephanie, who is a service user, isn't that right, Maria?
Stephanie is a care worker with social care worker with Connected Health, who supported a family during COVID. So we're just going to play this video now just to show you to tell her story.
William McCormick was one of my first clients whenever I started with Connected Health as a care assistant, and he just had that kind of personality. It was just bubbly, it was just full of fun.
Well, Stephanie was one of the original carers that came on to Daddy, and I mean there was a great rapport between them. And she called him Wally Mac. That was a wee favourite name they had for him. They called him Wally Mac. Daddy just loved seeing them coming on, and Mummy as well. You know, they give Mummy so much support as well, and nothing was too much trouble for them.
At the time Wally tested positive, I made the decision that I would go on the COVID run and care for Wally, to give him a familiar face that he knew. The first week was lovely because it was just like back to the days whenever I was caring for Wally initially. Whenever I started, Wally was full of fun, full of carry on. It was just really to give him a wee hand to get washed, to prompt him. Wally was never a man for being in bed, and obviously COVID put him in his bed, so I was just reassuring him that you need to eat, you need to do this. If you want to get back out of bed, these are the steps that you need to take.
You know, even when Daddy didn't want anything to eat, Stephanie would always go and make him something, and he always ate it, you know, for her. She was just brilliant with Daddy. You know, I class her as a friend.
Nearly part of the family. You know, she always reassured us, Suzanne, look, if you need me, and she says, you call me anytime, day or night, anytime. And that did reassure us. And I mean, Stephanie has a young family, and we were mindful of that.
There was times you thought, oh, what am I doing? Like I have 3 small children, I have a daddy that has COPD, but with being involved with COVID from March, I sort of felt safe. I knew that the PPE, that everything was there, and I just went for it.
Daddy was just meant to be at home with us, you know, and we were so thankful for that. But I'm saying that we couldn't have done it without Stephanie and the COVID team. Stephanie was one of the first people to ring after we'd told the family that Daddy had passed away that morning, and she was down within half an hour. You know, and to have that support at that time was just amazing.
Even on the day of the funeral, she stayed with Mummy, and Mummy watched it on the tablet, Daddy's funeral, and she stayed with her the whole time.
We just couldn't have done it without her.
I really do love my job. You see the sense of fulfillment you get of meeting these vulnerable people, and then you can go back to do a wee client monitoring to check in to see how happy that the service you've provided for them makes them feel is amazing. It's really fulfilling. There's nothing else that I would like to do.
Thank you to Stephanie and that family for allowing that video to be made, because it just shows the impact that you have on the families that you work with. And working in health and social care can be very rewarding and fulfilling. We're moving on to self-care now. However, you may be in situations where work pressures and strains take their toll on you. And you may find it especially demanding when supporting a person who is dying. It may also be difficult when you're required to provide comfort, advice, and information to bereaved people. As you saw in that film, the people you're supporting and their families greatly appreciate the care, support, and compassion you give to them when they're dealing with death and bereavement. They often respect and admire you, understanding how difficult it must be for you to carry out your duties in the midst of sadness, distress, and strong emotions. It's important that you take care of yourself and are able to recognise stress and build resilience to enable you to continue providing care and support to others. So that, I mean, it's no matter which part of this resource you look at, please take in the self-care section. And in it, there is recognising stress, building resilience, healthy coping mechanisms, and managing personal bereavement, because as we said at the start, we are all bereaved people ourselves, and sometimes when we're supporting somebody else who is bereaved, it brings back our own emotions about the loss that we have had. I just find my right place over here. Your role is vital and valued. Let me just get to here, sorry. I think I've said all those bits. One of the things to really remember is your boundaries, and it's really hard not to get involved or maybe over involved with people when you have been providing that that care to them at this time, and that family did say we look on her as a friend, and that is lovely at that time, but you need to know your boundaries and keep yourself safe, and you would have standards around that. So just be careful around those things. It is important to look after yourself. It is important to build your resilience, because you might be working in a role where you are facing death all the time. And I even think about my volunteers, and some of them are on today, and they're ringing bereaved people all day. So we need to know how to look after ourselves during those times. It has been suggested that repeated exposure to intense emotions in an unsupported environment can lead to burnout. Therefore, there's a need to recognise, relieve and manage any stress that may arise. And there are different ways that stress can manifest itself. It can be exhaustion, can be anxiety, it can be irritability or forgetfulness. And you do all the good things at work, and then you come home and you take it out in the family, so we don't want that to happen. So it's important that you recognise it and take steps to manage it. And being part of a team is a really, really important part of that, and that's one of the reasons how we build our resilience. So the training that you get I mean, feeling confident about what you're doing, knowing what you're meant to have done, going home thinking we did the best we could for that family today helps to manage our stress and helps to build resilience. We want to have a culture where you're supported and that people are looking out for you as well as you looking out for the people in your team. So think about your training needs, or think about, first of all, if something has happened on a particular day at work, that you have a chance to talk about that before you go home. And that's emotional defusing or debriefing. And it's good to share the experience with the people that were with you. And some of you might be lone workers, some of you might be going into homes on your own and you don't feel you have that team, but find somebody that you can talk to about it during the day before you do go home. Sometimes we have a more formal debrief with a particularly difficult situation and something that's been unanticipated and that has emotionally upset you or whatever. Fine. Sometimes the manager will organise a time where people can come and talk about that, or think about it yourself, or write a journal, or do whatever you feel helps you. And take all the training opportunities that you can, so that you feel as well equipped as you possibly can be for the role that you play. I just want to go through some healthy coping mechanisms. And here's a lady doing her stretches. I don't know if that's you, but think about it was particularly hard during lockdown actually for us to do that because the gyms were closed. We were allowed one walk a day. Remember, you were allowed one walk a day. And but find those healthy coping mechanisms such as exercising, or maybe you like reading or crafting or making lovely food, or make sure you get enough sleep. And I mean, if there are any nurses on this call, nurses never get enough sleep, and probably social workers and social care staff are the same. But be aware of the feeling that you are getting stressed. Know what your triggers are, or know how you feel when you're stressed, and you know that you need to take some time out. And just on the other side of that, there are some unhealthy coping mechanisms that people adopt, and please think that the quick fixes of possibly alcohol or caffeine or drugs or any of those kind of things may help you for a very short time, but they only give you another problem. So look more to the healthy coping mechanisms. I always say when I'm doing this face to face, if you're driving home from work with a big bottle of red wine hanging in front of your eyes to say, I can't wait to get home to crack this open to cope with my day, all I'm saying is just don't do that every single day. You know, that's not good. And just about personal bereavement to finish. So whenever people are off with a personal bereavement and are thinking about coming back to work, sometimes work is a good place to go, and it puts a structure around your day, and it's good to get back to the team. But in a job like ours, sometimes going back to work is really hard because you're going to face a situation similar to the one that you have personally experienced. So chat to your manager about how you're going to manage that. Maybe meet your manager and your colleagues before you do come back, and have a plan of how you'll work your day, especially if you feel overwhelmed by it. And there's a section here in Cruise as well. There's a recording about self-care, which will be helpful for you, hopefully, and lots of links and a learning scenario there too. Just before we finish, we put some challenging situations that might challenge you in, because not every day goes to plan. Sure, it doesn't. We can have a plan for the day, and then we come to work and we're presented with something completely different, and something that requires us to think on our feet. And we have no script for it. So we included 4 scenarios to get you thinking about what would you do in each of the circumstances. At the end of the scenario, there is some feedback that after you've thought through what you would do, then you can have a wee look at what somebody else might do or give you some suggestions. And I was thinking of, have we got time to look through one? What's then everybody think? How are we doing for that?
Okay, yeah.
And I was thinking of the John, Gail, Arian and Claire scenario. And I'll just talk you through it. John is 74, was 74 and lived in his own home with his wife, Irene. He was discharged from hospital following a stroke 3 months earlier, and Gail, a support worker, is part of the team providing care to him. His daughter Claire lives in the same town and visits daily with her children when her children are at school and every evening. And she's an only child, so they're a very close family unit. John had made it clear that he didn't want interventions. Can you just click on that wee one there for me, Maria, because I'm not at it. And the care team is aware that while John was in hospital, his doctor had spoken to him about his wishes should his condition deteriorate further. And he'd made it very clear we wouldn't want any interventions that might keep him alive with a poor quality of life, and that home was where he would want to be at his end of life. And this was very hard for his wife especially, and for Claire, his daughter, to hear and accept. However, they respected his wishes and supported his decisions. And when Gail arrived one morning, both Arian and Claire were in the house and they were waiting for the ambulance, because Arian had wakened and found John unconscious, and she'd called Claire Aunt 999. Now Claire, when she arrived, reminded her mum of her father's wishes and that he wanted to be at home, but Arian was keen to get him to hospital to see if there was anything could be done for him, and she was worrying that he might die when they were on their own with him. When Gail went in to check with him, his colour was poor, he was clammy, and his breathing was laboured. And he didn't respond when she spoke to him or touched him. And she felt it was important to get Arian and Claire into the room to sit with him. She felt upset as she was very fond of John, and it looked like he was nearing death. But she was also disturbed as she knew how much Arian and Claire loved him and each other, and she didn't like to see that they wanted different things at this very significant time for John. So then whenever you read that, there are some questions that you have to look at. What were some of the things Gail did really well in this difficult situation? What support do you think would be needed to help Arian and Claire carry out John's wishes? And what would be important for Gail now to help her address her own feelings following this experience? So you have a wee opportunity to think about that. And then when you've done that, you can look up the answers. No, don't look up the answers first. Go through it yourself first in these cases, and then see what people think. Whenever individuals, I mean, it is true, whenever individuals decide that they would like to be at home to die, that is a big responsibility for their family members. I mean, it's not an easy thing to have someone who is that ill at home, and they do really rely on the support of their carers who come in. And they have their carers 4 times a day, but most of the time, probably 22 or 20 to 22 hours of every day, the family are with them on their own. And always remember that and we would think about that in hospital, you know, why do these people turn up at ED? And sometimes it's just because it's all too hard for the family at home. So supporting a family to hear each other when their views are different is so important, especially in a crisis situation. And to help them stay with John and be there for him was really important. Gail did very well in this circumstance and wanted to stay, which meant that it was important for her to tell her manager that she was going to be there for longer than she normally would be, and that her be allowed to stay with the family. And she was a quiet, supportive witness to Claire and her mum, and she allowed some listening and speaking to happen. And because John was actively dying, she offered a calm presence and a gentle reassurance that Claire and Arian weren't alone in carrying the worry of honouring John's wishes and still do the right thing. So in situations such as this, that calm, supportive presence can allow family members to begin the work of reminiscence, storytelling about John, and maybe even have their chance to say their goodbyes. And this work is so important in helping family members prepare for the death of someone they love, and can ease the pain of their grief afterwards, and can make them feel good that they were able to carry out John's wishes, because that's always something that is really important to people afterwards. So Gail did really well in most of this difficult situation. Okay. The next thing, I mean, there are different scenarios in different settings. I mean, we tried to have a scenario that would apply, one scenario that would apply to everybody who is watching them or to going through the thing. Rosina then did a lovely video, and we're going to have that to finish our bit. And if you're not crying already, I'll give you a warning that, yeah, and you probably are already, because I nearly was there, listened to the last one. But I definitely did when I listened to Rosina. So again, it's such a valuable film.
I'm Rosina Robinson, and I've worked for the health service and dom care for 25 years. I've always worked with sort of complex needs clients, but this past maybe 7 or 8 years, it's been complex needs and palliative care. We came into care for John approximately between 2 and 3 weeks just before he passed. His family were finding it increasingly difficult to manage with him because things were just going downhill rapidly. His lung function, he had lung cancer, and his lung function wasn't as great, and his mobility was very poor. So he basically wasn't able to get up and move about the same, so they needed help. 9 times out of 10, they're very glad to see you because they do need the help, tend to show you where everything is, explain what's been going on, explain what's been happening, how they've been, really ask you what's going to be coming, what's going to be happening, and we really wouldn't have the answers to that, but you're trying to put them at ease, give them as much information as you can, to empathise with them, to reassure them, especially that's very important, that they're reassured that you're going to be able to keep their loved one comfortable, because that's the most important thing, that they're comfortable. With John, our main task would have been to help him with all his personal care, just to make sure that he was comfortable, clean, and that he was able to stay at home and be comfortable in his own house, Within 2 days, he wasn't able to use the bathroom anymore. We weren't able to physically take him to go and get washed and changed. His mobility was such that he couldn't. So I had to then bring a basin into the bedroom, and that was a big thing because he was a very independent man, for us to have to say to him, no, I don't think you're able to do that. It was difficult for him. And that only went on for maybe a week. Then he couldn't sit up in bed even, he had to be washed, bed bath basically. And by the time it got to that point, he had to have a catheter. He had also a syringe driver in because he couldn't take oral medication anymore. He couldn't swallow. He would share a bed with his wife. He was in a double bed. As his mobility was worse, he had to go into a hospital bed. And that meant then that there was that separation where they weren't able to share a bed together anymore. And that was a loss in itself for both of them. It was a very emotional time, and it wasn't something that was easy for them to deal with. But I mean, she put a bed up beside him, and they were able to have some sort of closeness. Be there to listen and try to reassure them and to help them to maintain as much of their independence, even if it is only using the face cloth themselves, and being guided by them as to what they need. Everybody's individual, so they've all their own individual wants and needs. You can't go into 2 people and do exactly the same job in both. Sometimes it can be very emotional, even if you're only in for a short period of time. As a group, we tend to speak to each other. We work in pairs, so you've always somebody else there. If somebody passes away, we'll phone the rest of the team and let them know that that's happened, and we'll all talk about it. I'm looking after me, so the next family I go into, I'm okay to deal with that. So when we went back at the next call, he had passed. The family were lovely. They were very grateful that they had been able to have John at home. Very grateful for the care that they had. From everybody, not just us, from the nurses, from the doctors. And normally, we would go back, maybe the next day to speak to them, to pass on your condolences and whatever, But the way things are at the minute, you can't do that. And would normally, one of us maybe would attend the funeral. They were just so grateful to be able to have him at home and to have people going in and know that he was comfortable and know that at the time of his passing, they were able to be with him. I think that was the most important thing for them, that they were able to be there. It's really strange because even though you're sad, you're also happy that you've been able to help somebody. it takes you to want to do this sort of work. You know, I feel very privileged to be able to work with people whenever they're at that point in their life. Because apart from being born, it's one of the most important parts of your life is actually passing. You know, and for to be able to be with somebody and make sure they're comfortable with their family, and just at ease with passing is very important to me.
So that's sorry.
No, I was just going to say, in that one video, Rosina practically summed up the whole of the resource, you know, so thank you to her for that.
Thank you, Heather, for taking us through that and giving us a glimpse into what's in the resource. So we have taken you through some sections, but as you can see, there's a lot more sections within the resource that you can work your way through, and lots more content to support your understanding and knowledge of grief and bereavement. And we are really grateful to our reference group members like Heather here, who really helped us bring this all together. We're going to come out of the resource now and go back to the presentation. So just bear with me a moment. I'm just going to stop the share where I come out. Get us back. So,
I do hope you have seen enough today to feel that it is a valuable resource, and that you will want to share it with your teams, and you know, as part of maybe induction or training or anything like that, because it's going to equip them. It's going to equip them for hopefully their everyday work, but other things as well, and even in their own personal lives, and how to manage a bereavement in the family. Yeah. Sorry, Maria. Is everybody frozen but me? No. Is it?
Repeat that.
Can you hear me, Heather?
Yes, I can hear you. Can you hear me?
I can hear you, and I can see you move, so you're okay.
It did come up, you know, internet connection. I was like, oh no, that's good.
Fine.
Did you want, Heather, do you want to just repeat that last little bit you said, but then we'll move on?
Okay. It's just that I do hope that everybody who has been on today has seen the value of this resource and will use it themselves, will share it with their teams. There are parts of it that we didn't cover today, and it's like death in different circumstances, and that can be helpful if you go into a home or and you find yourself in a particular circumstance, you know, somebody has died unexpectedly, or somebody, I mean, because if you know all those things, then you can help the family, because they'll say to you, what am I going to do now? You know, and for you to be able to know what has to happen next is helpful to them. But I mean, and then, but also know where you need to pass it on to somebody else as well. So that's all I was going to say.
Thank you very much, Heather. Thank you. We're just going to move on because time is moving on. Just here to talk a little bit about some feedback. To ensure we're developing effective, efficient and enjoyable learning experiences, we pilot all our resources with end users and stakeholders before we publish and promote widely. And the content ref, we usually, you know, use our content reference group to support us to access frontline staff. And we were able to access frontline staff and managers within the South Eastern Trust and the Western Trust. And we ran a pilot for 2 weeks in June. And what you see on the screen there is it's just a flavouring of some of the feedback we got at that time. And as you can see, it's overwhelmingly positive, with 100% of respondents rating the resource as excellent or good, and all said they would recommend the resource to their colleagues. So as you can see, I'll not read all of them off the slide there. You can see them on this slide, but you know, things like professional, informative, supportive, good mix of learning tools, questions, you know, could be used individually with group or staff for shared learning and discussion. It's informative and relative. With the self-care section, be really well received. Pitched at the right level, very easy to use. I really appreciated the section on dementia and bereavement, as this is not always covered in training. and they felt all aspects of grief and bereavement was covered, and they really got to understand the different forms of grief, and that there's a variety of support groups for help. So it's a nice flavour of some of the feedback we got. We did also seek some service user feedback as well, and we worked with the Belfast Trust to access service users, and some of the feedback coming back was they thought the resource was excellent with comprehensive content written in easy to understand language. So that's just a little flavouring of the feedback we got. We also presented the resource to our Social Care Council Board and the Northern Ireland Bereavement Network, who were very overwhelmingly positive in their feedback as well, including the chair of the Northern Ireland Bereavement Network, Patricia Donnelly, who has endorsed the resource and has kindly agreed to be filmed talking about the value of the resource. So we're going to finish here this section with Patricia, a little film from Patricia Donnelly, before I hand back to Mervyn and Alison. Thank you for listening.
Thank you.
Mervyn.
As chair of the Northern Ireland Bereavement Network, I am delighted to endorse this invaluable grief and bereavement resource by the Northern Ireland Social Care Council. The resource will be an indispensable tool for social care workers at whatever stage they are in their social care journey, helping them to become more comfortable with death, grief and bereavement. The online tool will also have a wider impact for practitioners working across a range of settings, as well as for those who are bereaved and grieving. It is professional, smart, adaptable to the various ways that people learn, as well as being sensitive to the personal issues involved. Grief and bereavement work takes place this December, and it's important that we get the conversation going on bereavement and grief, something none of us can avoid. I am confident the Grief and Bereavement Resource will be an effective stepping stone in the improvement of services and support for those who are bereaved.
Okay, thank you for sticking with us so far. Hopefully you've enjoyed, if that's the right word, enjoyed the presentation. We're just going to move into a short section now where Alison and I are happy to field any questions or any comments. Thanks for what you've already put in the chat function. But if there's any questions, please do unmute now, and please fire ahead with any questions or indeed any comments. Thank you.
Maria, do you want to unshare?
While people are maybe thinking of a question, or Alison, do you want to say about the evaluation form?
Oh yes, yes. Just to let you know, like all our seminars, we will send out an evaluation this afternoon. So it'd be great if you could take just a few minutes. It's just a survey monkey, just to give us some feedback, because we do look at them and to see how we can make them better moving forward. So please, it would be appreciated. Thank you. Today, you may have noticed we are recording today's lunchtime seminar, and it will be available on the website in probably a week or two. We just need to get it edited. So we do try to share the link out with everyone after it's available. So take a wee bit of time to look at that. In fact, I'll put the link up to the website of where you can find the other recordings as well. We've recorded in the past.
One of the things, Maria, you might want to highlight is the fact that people don't need to go through the resource in one sitting. You can do it in bits and pieces. And of course, because it's on our learning zone, then it's completely open access. So it's not just for the social care workforce. It's not just for people in health and social care. Anybody can log in, no passwords required, just straight login. Anything else you want to say about that, Maria?
No, that about covers it, Mervyn. As I said before, we do create them as open source because we're really, just really trying to provide good learning and provide access. Particularly it's aimed, our content's aimed at our registrants, but as Mervyn says, because we create it as open source, it is available and it is being used. We do know that our learning zone is being used by wider than our registrants and across the wider health and social care, and it's available then for users and carers and service users as well to use as well. So yes, it's not meant to be completed in one sitting. It would be quite a cognitive overload if you try to do it in one sitting. So it's meant to be, you know, done in bite size. We built it as a bite size sort of resource to be dipped in and out of, so that the users can go back to it as often as they want, and that's to help them remember what they need to know.
Hi, I'm Michael Shields and one of Heather's volunteers. I just want to get the definition right. When you say open source, would that mean I could access it from a home PC, or does it have to be on the Trust network?
No, it's open. The Learning Zone, if you Google even Learning Zone, NISC Learning Zone, you can get in very easily, and it'll adapt to whatever device you're on. So you can access it from your mobile, your tablet, your desktop, your PC. So it's very easy. You just go to the link.
That's great. Thank you.
Reverend Denise would like to ask a question. Denise Kelly.
Hi, Denise.
Hi, Marvin. Hi, Maria. Hi, Heather. And the rest of you out there. Yes, I just introduce myself for those of you who don't know me. I'm Denise Kelly. I'm the social work lead in the Community Oncology Palliative Care team in the Belfast Trust. So I just want to say, well done. This is a wonderful resource. I suppose myself and Nicola and Laura here from the team are on the call, and you know, I'm just thinking this would be wonderful for us when we're training our social work, care management staff in the trust. If you'd be happy enough for us to embed the link into our presentations, would that be okay, or to at least direct then the staff to the site?
No, that would be fine. We'd welcome that.
Yeah, absolutely. I mean, our aim in this is to get this out as wide as possible. And some people have said this in the chat function as well. Please take it and use it and run with it. To be pedantic about it, we'll say it's not training, but it is to aid learning. It's to resource people. But please, yes, do take it up and run with it. And thanks, Alison, for putting the link up there to the Learning Zone. And I mean, please, I would encourage you just to go on the Learning Zone. And I think there's now something like over 50 resources on it. So whilst our focus today is on grief and bereavement, there's so many other resources there, and please do use them. And the other thing I would say is that, you know, they're not set in stone either. You know, we've got some experts here. In fact, probably everybody's an expert. But if you've got any comments or any suggestions, or you think we haven't got it right, we can change things, we can tweak things, and we can update things. So we're really interested in getting people's comments back on any of our resources, but particularly because of today, we're keen to hear any suggestions around this particular resource.
Great, thank you very much. Fantastic, great work.
Okay, thank you. Any other questions?
No, don't see any other hands.
Okay.
Oh, Alison.
Hi, no, I'm Alison McRae, and I just wanted to say, so I've recently got the lovely job, and I mean that, for managing the bereavement team. They've just come under central nursing. So I just want to say a really big congratulations to the team and all the volunteers, and to yourselves, and especially to Heather for giving that wonderful presentation. And I know she's had a lot of work involved. I suppose the challenge then, certainly for the Belfast Trust, it is a huge trust, and I suppose the challenge for us in central nursing is to get the link out there and get it embedded so that the nurses know where it is and they can have access to it. So certainly I'll be liaising with the education side of the house for central nursing to see, you know, what they can do to try and promote it.
Okay, thank you. Awesome. And the other thing as well, I mean, you've probably picked it up clearly today that, you know, the films speak so powerfully, and I think Alison has put up in the link as well how you can access those films and indeed other films that we have. So again, feel free to pick those up and run with them. Please do use them.